My name is Chen. I serve as the professor of Institute of Epidemiology and Preventive Medicine at National Taiwan University. My research focuses on health issues which include dementia and cognitive function in the old people. My research includes two parts. The first part is a case control study on dementia between 2007 to 2011. This was a case control study which recruited Alzheimer's disease and the small vessel vascular dementia patients from neurology clinic of 3 teaching hospitals in Taipei with a total of about 1,000 participants. A large part of this study was to explore genetic factors in relation to dementia. We explore candidate genes involved in inflammation, neurotransmission, and neurotrophin. I also conducted the first genome-wide association study of Alzheimer's disease in Chinese population. Instead of using p-value for selection of genetic markers, which suffered from high false positive, I used 10 practical performance metrics, for example, like sensitivity and specificity, to select genetic markers with sound prediction in Chinese. Another important part is environmental factor. Based on the same data set, we found that long-term exposure to PM10 and ozone was associated with 2 to 3-fold increased risk of clinical diagnosed Alzheimer's disease and vascular dementia. The importance of this study is to facilitate environmental protection agency to consider dementia as one of the health outcomes while revising the air standards. The second part is an ongoing cohort study on cognitive function in non-demented old people started from 2011. Because there is no cure of Alzheimer's disease, in order to prevent this disease at an early stage, I started this cohort study and recruited about 600 non-demented elders at baseline and followed up every 2 years. Because Western diet, like Mediterranean diet, is not suitable for Chinese, for the first time, we identified 3 dietary patterns for prediction of cognitive changes in Chinese. We also explored and found that renal dysfunction was associated with cortical thinning in the brain. Third, we found a previous H. pylori infection was associated with increased risk of cognitive impairment. This study includes not only questionnaire data and the various biomarkers, we also have brain and eye imaging and air pollutants data. We are expecting more important research findings from this cohort in the near future. Thank you.